Hello, I'm the Simulation Coordinator for the UNC School of Nursing. We are committed to providing a state-of-the-art experience for undergraduate and graduate students. We work diligently to continuously improve our simulation program so that it is evidence-based and consistent with industry standards. The purpose of this video is to orient you to the simulation program. There will be a few things about our philosophy and some basics about the equipment and supplies and our mannequins. I'd like to discuss a little bit about our simulation philosophy. One of our primary goals is to create a culture of safety where students can learn. We define culture as safety as an inclusive environment where everyone is not only encouraged to contribute, but expected to. We expect that students and faculty will be supportive and encouraging in feedback that they give to each other, and that feedback will be given with the purpose of learning for everyone involved in the scenario event. We consider each scenario and debriefing a confidential event, and that details of the event are not shared with others who did not participate. In a culture of safety, mistakes are not seen as errors, but as opportunities for the entire group to learn. There are potential gaps in performance and understanding, and we unravel these gaps to help understand thinking and decision-making processes. We don't expect that you will perform perfectly. That is one of the purposes of simulation. We want to know what you don't know. Understand that we will also closely examine the things that are done correctly, as we know that sometimes people perform the correct intervention, but for the wrong reason. Simulation is not graded. This contributes to a safe learning environment because you can take risks in decision-making knowing that it will not adversely affect your grade. Even though simulated clinical events are not graded, they will be evaluated. Evaluation is a strong component of our simulation program. We strive to have high levels of fidelity in our program, meaning that the experience is as close to real life as we can possibly get. We understand that the mannequins are not real people, but ask that you treat them as if they were. You may have to suspend reality a little to do this, but it contributes enormously to what you are able to learn from the event.
You will prepare for your simulation experience just like a clinical opportunity. You will be assigned specific patient scenarios or topics to prep on, as if you are going to be the primary nurse or practitioner. The better prepared you are for the learning experience, the more you will get out of it. Thorough preparation includes the course-assigned simulation prep work, an understanding of the diagnostic tests or results provided, potential patient procedures, as well as the pharmacology that may be used in the scenarios. This enhances your ability to contribute in the simulation and to the debriefing that follows. You are expected to follow the dress code that you do on your clinical sites. This applies to uniform, name tag, hairstyle, facial hair, piercings, nail care, etc. You may need some of the tools in simulation that you would on the clinical floor, so please bring your stethoscope, a watch, writing utensil, a small notepad, and simulation prep work. The simulation etiquette applies to all simulation scenarios, each time and always. Please wash your hands as you enter the room. Introduce yourself to the patient and their family or guests as you enter the room, and also provide them with your role. You may be assigned as the nurse, practitioner, or an alternative role that aids in the realism of the scenario. If you are assigned to be in a role outside of your education, you will be provided a script. You may also be assigned a family member role, in which you will also be provided a script. Simulation may offer the opportunity to perform invasive procedures or tasks that require added protection. Please don gloves, wear protective equipment, and maintain sterility to aid in the importance of acquiring these habitual steps. It is encouraged to approach simulation as though you would for your clinical patient. For example, a typical process after hygiene and introductions would be to obtain vital signs, complete an assessment, provide patient teaching, perform appropriate procedures or tasks, and then reassess. The simulation team strives to anticipate and provide what you will need in the simulation, so please assume that you will be carrying out your process as though you would in clinical. The facilitators understand the time constraints for assessments and procedures. This time will be built into the scenario if it is meant to meet your learning objectives. Therefore, if you want to start an IV or place a catheter, please do so. Vital signs should be obtained from your patient, not the monitor. There are some values that cannot be obtained from the mannequin, like temperature or certain diagnostics, and those values will be provided to you in the appropriate time frame. The simulation facilitator and faculty are able to observe the simulation. However, we ask that you narrate what you are doing so that we know what you have done. For example, stating, "I am administering 1 milligram of epinephrine," or "I am giving you your 40 milliequivalents of potassium," as you are performing the task. Please be in the habit of using appropriate and professional ways of communicating to other disciplines. Use SBAR communication when reporting or handing off to a team member in the scenario. There may be students in the simulation group that have the role of observer. These individuals should be actively learning, taking notes, critically thinking along with their peers as though they were the nurse or provider in the scenario. Research has demonstrated that the observer role is important and significantly contribute to the debriefing following the scenario. If you do have an observation role and are asked to observe from the control room, please respect that it is a quiet environment. Side conversations, phone use, or talking in the simulation is very distracting.
Good day, UNC nursing students. Please allow me to introduce myself. My name is Lucina. My name is Greek for the goddess of childbirth. I can actually deliver a baby during simulation, so if I happen to yell, "Don't touch me," it's not personal. After all, I am having a baby. But I do need you to remember that I am a goddess. I would like to introduce you to my friends. This is Janus. His name is also Greek for god of beginnings, choices, and open doors. Chiron here is also Greek for kind and gentle teacher. You can call him Kai. We will be an integral part of your simulation training and learning. When we are not sick, we really like the Greek life here on campus. The three of us are high fidelity mannequins. Fidelity meaning how close to exactness. For us in nursing, that would mean reality. We have some very specific guidelines for our care because we are high maintenance. First, we contain latex. If you have a latex allergy, please let your instructor know. Speaking of allergies, mine is betadine. Please do not use it on me. Please always introduce yourself and treat me with respect. I am your patient. Talk to me and not the patient monitor in the room. Always make eye contact with me. Do not use any pens or markers in my vicinity. We do not like ink. Never put any meds or anything in our mouths. Use only approved mannequin lubricant provided in the lab. Please do not ever move me from the bed and place me on the floor. We weigh a lot, and a patient on the floor would be a very bad thing. You will receive important instruction on appropriate size needles for use on us. This is very important. Please do not leave any equipment or supplies attached to me once simulation is complete or you have finished your skills practice. We have another group of friends you will be working with in the skills lab who need the same type of care. They are not as high maintenance as we are, but they too are your patient.
Finally, every scenario event is followed by a debriefing. Research has indicated that debriefing is the most important part of the scenario event and where learners make sense out of what occurred through thoughtful reflection and discussion. Everyone in debriefing is expected to contribute, and we ask that you reflect not just on what went wrong in this scenario and what mistakes were made, but also what went well, how it made you feel, and particularly how you will apply what you have learned in this scenario event to what you are currently doing in clinical practice. In every debriefing, you should be asking yourself, what is my takeaway from this event? It is extremely important that debriefing is kept confidential and that people are free to express their feelings about what happened during the scenario without feeling penalized. It is required that all communication in debriefing be respectful and supportive, even if disagreements arise. We hope that this information was helpful for you. If you have additional questions or suggestions, you can contact your faculty or anyone on the simulation team. Thank you for your time.